Hello, my name is Roxanne Gabayan Badanas, and I am calling from the Medicare Rojas Department of Health. Could I please speak with Miss Sheila Jane Bagona?
Yes, this is Sheila Jane Bagona.
Yes, ma'am. I am calling to collect some follow-up information regarding your recent lab test result. Before we begin, I just want to confirm your date of birth and address. Could you share those with me?
My birthday is June 10, 2003, Barangay Tumarbong, Rojas, Palawan.
Okay, ma'am. Your birth date was on June 10, 2003, and your address is on Barangay Tumarbong, Rojas, Palawan. All of the information that we talk about will be kept confidential, and only people who need to know will have access to it, ma'am. The information is only used to help us stop the spread of COVID-19 and make sure you are healthy. Everything is entered into a high protected database. Is it okay if I continue, ma'am?
Yes.
Ma'am, did your healthcare provider already told you about you having a COVID-19?
No.
Ma'am, you've been diagnosed of having COVID-19. The result of your SARS-CoV-2 test is positive. I would like now to follow up on your diagnosis with COVID-19. I also want to go over next step in taking care of yourself and preventing infection in others. I will ask a number of questions to get all the information that is needed to best determine how can we help you. Question I will ask will cover some basic information about you, any symptoms you have, exposures you may have before becoming sick, and contacts you may have had since you become sick. Is now a good time to talk? This is a very important part of stopping the spread of the virus, ma'am, and I appreciate your time and help to do this. What question do you have at this point, ma'am?
Yes, it's a good time.
Thank you, ma'am. We will get started. Feel free to stop me at any time with questions or if you need to get off the phone. Ma'am, I would like to tell you how COVID-19 spread. It is spread through close contact with a person who is infected with the virus that causes COVID-19. Sometimes it is spread for a short time through the air when the infected person coughs or Ma'am, have you had any symptoms of COVID-19 like coughing or do you sneeze?
Yes, ma'am.
I will now ask what date it started, ma'am.
January 1, 2020.
Where was your test done, ma'am, and what date was it done?
Rojas, Palawan on January 5, 2020.
Do you have any current medical condition, ma'am?
No, ma'am.
I want to assure you that we will not release your name and your contact, ma'am, and you are not required to personally notify them of their potential exposure. It is very important to let your household contacts know that they should stay home and quarantine for 14 days from the date of their last exposure to you. We would like to collect information on anyone who you have been in close contact or in proximate contact with. Beginning 2 days prior to your onset of illness and up until you started self-isolation, we are particularly interested in learning about anyone who is a household contact, those over particular 65, immunocompromised, or those living or working in a congregate setting serving a vulnerable population, ma'am, like in a healthcare facility, in a shelter, or in jail. We will reach out to your contact to notify and follow up with them. Your name will not be released to your contacts. Ma'am, let's start with the people who live with you. Please tell me the names of the people who have been living with you beginning 48 hours before you started feeling sick. For 10 days, you were tested if case of asymptomatic until today. It is very important to let your household contacts know that you are sick and that we will be following up with them shortly. Now, let's turn our attention to where you were 48 hours before you became sick. Again, I want to assure you, ma'am, that we will not release your name to your contacts, and you are not required to personally notify them of their potential exposure. Did you work outside of the home at this time?
Yes.
So, ma'am, please tell me about any coworkers you work with those days.
Justin Padul, Flor
Go.
Justin Padul, Florian Domingo, Flor Gajardo, Rosemary Lagrada, Cecil Segovia, and Louis Lim.
Oh, ma'am, were you any place within 48 hours of becoming sick?
Yes. In my workplace, market, and grocery store.
Finally, did anyone visit your home, ma'am, within 48 hours of you becoming sick?
Go.
Yes.
Go.
Who are those persons, ma'am?
Ivan Makapinig, Connie Badenas, Ronald James Villademosa, Eliezer Sesmuan, and Brick Sanchez.
Ma'am, did you go grocery shopping or run any errands? Or did you meet up with your friends like on a coffee shop, in a gas station, in a bank, or any else, ma'am?
No.
Go.
Ma'am, since you are positive of COVID-19, it is very important that you stay at home and distance yourself from others so that you don't pass the infection to anyone else. So, you will be required to isolate. That means you stay at home until you are fever-free for 3 to 10 days after your symptom first appeared. You will also be required to monitor your symptoms for all the days you are in isolation. Being in isolation is a legal requirement, and your local health department will issue a legal isolation order to you. Do you agree to allow us to send you the isolation order by email?
Yan.
Yes.
Hey ma'am, by accepting the order this way, you are allowing health officials to spend more time focusing on slowing the spread of the virus, ma'am. Now, I am going to discuss how you should self-isolate to protect others in your household from exposure. Ma'am, you should stay in one room away from others as much as possible. It is particularly important to stay away from people who are at higher risk of serious illness, such as those who have underlying medical conditions, are immunosuppressed, are over 60 years of age, or are pregnant. We can discuss alternate living arrangements for you or them if needed. And also, use a separate bathroom. If this is not possible, clean the bathroom after every use. All the bathrooms should have a working sink, soap, and paper towels. Do not use cloth towels and never share towels with others. And also, ma'am, you stay at least 6 feet from others and wear a face mask if you are around others. Ideally, there should be a door that always separates you from others. Sleep in a private room with the door closed. Have food prepared by others and delivered to your door. Use disposable eating utensils if possible. Bag any garbage and leave it outside your door for pickup. It can be put in regular trash bin. Ma'am, you may need to have someone else do your laundry. Prohibited visitors who do not have an essential needed to be in the home. Ma'am, now I am going to ask you a questions about where you live. Please describe the place where you are currently living.
Go.
It's an open house.
Go.
Ma'am, are you able to isolate yourself at home, away from other household members, for at least 10 days and until symptoms clear?
Yes.
Other persons and pets currently living with you?
My mother, my cousin, and me. And I have a dog.
Bingo.
Okay, ma'am. Is there a door that separates this part of the house from others?
Bingo.
Yes.
Bingo.
Ma'am, can you use separate bathroom from other members of the household?
Bingo.
Yes.
Is where you live, ma'am, are safe from intruders?
Yes.
Ma'am, are there shared common areas in your house?
Yes.
Ma'am, do you need to use the same kitchen as others, or can be food be bought to you?
Yes.
Ma'am, please let me know if you have any concerns about being able to isolate. It is important that we work together to prevent the spread of illness. How do you feel about these guidelines, ma'am? Do you anticipate any challenges in following?
Okay for me and I follow the guide.
Said, you need to be monitored during the time you will be on the isolation. We'll be calling you daily for the next 14 days and we'll ask about how are you doing, your temperature, any symptoms, and any needs. Do you have a working thermometer, ma'am?
Yes.
Ma'am, as we discussed, you will need to isolate for at least 10 to 14 days from when you start to feel sick because you will not be able to go in the public. I want to ask if you think that you will need help with supplies or resources during this time. For example, it is important that you have enough food to last until the last next week, or will you need any medication delivered to you? Or do you have enough cleaning or household supplies available? Or do you need any assistance taking care of your pets or children or whom you are in a primary caregiver? Or at least do you need a caregiver to help you with your daily activities?
I need supply, food, and medication.
Ma'am, you may be able to identify a friend, neighbor, or family member who can assist you. But if not, please let me know as soon as possible if you need help. You can reach me to talk about any additional needs that you may have.
I will choose my mother to assist me.
Ma'am, please let me know if you feel unsafe in your home or at any point during your home isolation. Being infected with COVID-19, being in isolation for many days, and all that goes with this is a very trying experience. We can also arrange for you to talk with a trained professional if you are feeling anxious or depressed. I am glad that you feel well enough to be at home at this time. However, I want to be sure we have a plan in case you start to feel worse and think you need to see a doctor. If you feel that you need immediate emergency medical care, do not hesitate to call 0905 688 9011. In addition to telling the operator about your emergency, you should tell the operator that you've been diagnosed with COVID-19. Some signs of emergency include trouble breathing, persistent pain or pressure in the chest, new confusion, inability to wake or stay awake, bleached lips or face, bad injury or other emergency not related to COVID-19.
Bingo.
Do you have a healthcare provider, ma'am? And do you know how you are able to get in touch with him or her? Or do you have a health insurance?
No.
Ma'am, I am going to refer you to a community support specialist who can help you find healthcare, insurance coverage, and care with.
Bingo.
Thank you very much, ma'am, for your time. The information you shared is very helpful in keeping you safe, protecting those around you, and understanding the disease. Do you have any question for me, ma'am? I will call you again, ma'am, tomorrow at 8 a.m. Is it okay, ma'am?
Bingo.
Yes.
Doy.
Maybe add, If you have any question between now and when I talk to you tomorrow, here is my number. You can call our website with the information we just discussed, ma'am. Goodbye, ma'am. Thank you. Just keep safe.
Goodbye and thank you too.